Okay, this video is chapter 9 from the book Dr Mcdougall, The Doctor Who Fought for You. We're going to be talking about hypertension. So this is Dr. Mcdougall writing now. He says, a common myth is that the cause of high blood pressure is idiopathic, unknown. Actually, I'm going to add something to that. I can tell you, if you look at even the recent, Ivy League cardiovascular physiology books, pathophysiology books, they will tell you 90 or 90% of hypertension is idiopathic, essential hypertension. The cause is unknown. And like I'm telling you, all of the internal medicine books are a joke. They're a comedy. They're so bad, they're pathetic. You should think of them as like you would think of a medical book from, 1850, where the most common treatment is bloodletting, okay? They're stupid, okay? You should not say they're okay. You should not say they're reasonable. They are stupid, pathetic, disgraceful, and an embarrassment. And why would I say that? Because you go into a low-fat, vegan eating community, and there is no hypertension. There'll be nobody hypertensive. There'll be some rare, weird cause, 1 in 10,000 or something. I'm just telling you, it's BS. So these books, they pretend to tell you the truth, these internal medicine textbooks. They go, well, this disease is associated with aging. It seems to be partly genetic. Sometimes it's due to an infection. And, sometimes it's due to socioeconomic, deficiencies and limitations. And they act like they're being nice. No, that's bullshit. It's a big lie. I'm just telling you, this is big trick that tricks all the medical students. Everybody believes it. When I was a young guy, I believed it. Once you know something a little bit about disease, nutrition, toxicology, you realize that all of the internal medicine textbooks are stupid. They're all a joke. They're all fake. Just so you know that. Okay. All right. So why do I say that? Because when a population eats a low-fat, plant-based diet, they don't get hypertension without excessive sodium, okay? And excessive sodium can get you into hypertension as well. Those are the two big things, excessive dietary fat and excessive sodium. But if you avoid those things, you're very unlikely to become hypertensive. Okay, so continuing with Dr. Mcdougall. And by the way, hypertension is the number one risk factor for atherosclerosis, for stroke, for, periventricular small strokes, silent strokes in the brain. It kills people. It's like one of the most common reasons people die. So the fact that it's easily preventable, that's worth knowing. Okay, Dr. Mcdougall continues. High blood pressure is a symptom of a cardiovascular system that is ill. Many doctors will pull out a prescription pad whenever a patient's blood pressure is more than 140/80. But it's better to wait. To wait until they have a higher pressure that's sustained, like the recommendations of the Cochrane collaboration. For example, something like 150 or 160 systolic over 90 to 100 diastolic. I typically start hypertension medications when the pressure is sustained over 160 over 100. So 160 systolic, 100 diastolic millimeters Hg. Very few people have that high of a pressure on a sustained basis. Transient episodes like this are common, but sustained is not. Normal blood pressure in a person who is not on medications is about 110 over 70. Now, you don't want to lower diastolic pressure below 85 because that is associated with decreased perfusion of the brain and the heart. Remember, the left ventricle perfuses largely during diastole, cardiac relaxation phase, so the muscle's not contracted and the penetrating arteries, intramyocardial arteries, can get in there, okay? Let's see. If you drop the diastolic below 85 in a hypertensive patient, that's associated with increased risk of dizziness, falls, dementia, stroke, heart attack, and death. I've talked about how overtreated hypertension drops blood supply to the brain. Why do you think a person's hypertensive? Because they got to get blood to the top of their brain, the cerebral cortex, pumping against gravity. That's the hardest spot to pump to. So the blood pressure is dependent on what does it take to get blood to the top of the cerebral cortex. Okay? So if you overtreat that, don't worry about the number. Worry about how the person feels, okay, and what's a good, safe range for blood pressure. If you overtreat hypertension, you underperfuse the cerebral cortex on the top of the brain, and people get lots of silent strokes up there. Also, the person can get symptomatic, dizzy, lightheaded, and they fall, and they can get all kinds of problems when they fall. Hip fracture, wrist fracture, spine fracture, intracranial bleed. Okay, the blood pressure curve has a U shape. And this means that the risk of cardiovascular events is increased when the blood pressure is too low due to overtreatment or too high due to undertreatment. The bottom of the U-shaped curve is about 80 to 85 diastolic pressure. The goal of treatment is to keep the blood pressure around 150 over 90. Treatment to below 140 over 80 is too low. Blood pressure above, would you hear that? A lot of people don't know that, because I know a lot of hypertensive, they think they got to get their pressure lower and lower. So listen to Mcdougall. He says treatment to below 140 over 80 is too low. Blood pressure above 160 over 100 is too high. In between those numbers is the sweet spot, approximately systolics of 140 to 160 and diastolics of 80 to 100. Most patients can achieve this goal with diet therapy alone. You do not want to overtreat blood pressure. It's kind of like overtreating blood sugar. It's a bad idea. You can cause brain damage. Lower is not better. Patients need to hear that. Lower is not better. The first step is to get a proper measurement of blood pressure. No coffee. Coffee raises blood pressure. It's good for the patient to measure their blood pressure at home. The cuff should fit properly. If the cuff is too small, you've got to elevate the pressure. Those are the sizes: small, usual size, or large. A quiet room, comfortable temperature, no smoking or exercise in the 30 minutes before blood pressure check. They shouldn't be talking too much. Sometimes it's tempting to just talk if there's somebody with them. That'll increase your pressure. Empty the urinary bladder. Take 3 measurements at 1-minute intervals. Usually then you can go by the average of the last 2. The first one's often higher than it should be. Have the feet flat on the floor. The patient should be seated with their feet flat on the floor. Again, wait about 5 or 10 minutes after getting seated. And then check the blood pressure. No talking between measurements. Your arm should be bare. It should be at rest. The mid part of the upper arm at the heart level should be about the heart level, relative to your heart. The patient should not be talking while the blood pressure is measured. Exercise on a routine basis leads to a lower resting blood pressure. Sunshine lowers blood pressure because it activates all the systemic vasodilators. The most important factor in controlling blood pressure is food. And the most important cause of high blood pressure is blood sludge due to dietary fat. And chronic hypertension is also associated with an increase in atherosclerosis. These atherosclerosis narrowings lead to increased peripheral resistance. Okay, so that's an important point. It's sort of Nathan Pritikin and Dr. Mcdougall strongly emphasize that dietary fat is the main cause of high blood pressure. The second school of thought is the people who think excess dietary sodium is the main cause of hypertension. Like, look at all these Japanese people that were real hypertensive because they're smoking cigarettes, they're eating tons of sodium, like 12 to 14 grams a day. Okay, and then the third school of thought on why is hypertension so common in these meat eaters is because meat has all the bad stuff. It's high in fat. It's often preserved and flavored with sodium. And then it lacks the good stuff. The good stuff comes from plants. So you just eat the plants, you get the vasodilators, you get the potassium, you get the magnesium, you get the antioxidants, you get the fiber to prevent postprandial endotoxemia and clotting related to that. You get the nitrate precursors from the greens that lead to production of nitric oxide, systemic vasodilator. So you get all these good things that come from the plants. So just by switching from a meat diet or a processed food diet to a plant-based diet, you all of a sudden get all the good stuff to dilate your arteries and improve your blood pressure. So that's why plants are like a double whammy. So you go from a high-fat meat and sodium diet, and you switch to a plant-based diet that's low sodium, you can expect a dramatic improvement in blood pressure. Okay, so that's it for today. That's part 1 on hypertension.